Okay, good evening, everyone. Um, Welcome again to the interview session, and my name is Stella. As we start, and please try to mute your mic. If you know you're not speaking, and if you know you are speaking, you can unmute your mic to speak. Okay, this is an interview section whereby we have to practice. It has to be very practical, so we'll try and make it much as practical as much as possible so that we can all interact, because at the end of the day you have to speak for you to be able to pass your interview. So you can't go for an interview and you're being asked a question, how do you do this, how do you think you can achieve this, give me an example of when you have done such a thing, and you are muted, you don't really know what to say. Okay, but and that's not really good, it doesn't give a good impression. But if you are prepared ahead of time, and you know what to say when you are being asked, it makes you and it gives you an advantage over others that are not very fluent or eloquent when they ask them what to say, or or for them to give an answer, they begin to stammer. So it gives you an advantage because you have practiced in your secrets, you have practiced with somebody, you have practiced live, and you already know how it is going to be. You have looked at yourself in the mirror and say, okay, all right, how do I speak? Do I have to speak phonetic, or try to change my voice? Which you do not have to. You only have to speak like normal, confidently, just be yourself, your own natural atmosphere. And the beautiful thing about most of the interview you guys do is that it's virtual. It's different from when you do interview that's it's physical, you know. When you're doing physical interview, you can be like maybe fidgeting a bit because you are trying to monitor what person, oh, is my dressing well, hope I'm sat properly and all of that. But if it's online, you are in your own sphere, you're in your own atmosphere, your own space. So you begin to feel more confident. So all you need to do is to go there and get prepared for your interview. Okay. Now, like I was saying before I started recording this Zoom section, what I was trying to explain to everyone was that at times when you go for an interview and you didn't succeed, you should take it like oh, I wasn't successful and all of that. No, it shouldn't be like that. Instead, it should be the situation whereby, okay, this was an experience and you can decide to learn from it by sending an email to the organization that you did the interview with. At times, though, they might not respond to you, but some will respond to you. So, I mean, it causes no harm for you to ask a question, you know. So you can just ask them, oh, and if they give response to you, they might tell you, okay, well, maybe there's a particular question we asked you, we didn't really see that you were ready for that particular position, or we feel like maybe you need a bit more experience. And at times, the reason why you don't get an interview could be because, let's say, for example, you apply for an ICU job position, and you are being invited for that interview. Now, once you're invited for the interview, and you have other people, you don't have any background experience in ICU before, and you have other people that are quite experienced in it. At times, they might give more content because they are doing it practical, and you might give more theoretical knowledge. And because of that, they might take them over you. So it's just for you to know how best next to prepare yourself, probably watch more videos on the practical angle of it. It could also be because I hope Oda can hear me, because someone said she can't hear me. It could also be because of the fact that they have so many people for the position, and you guys were all so good. They just had to do many more. Father has a donkey and pick the ones that they feel like, okay, well, everybody is good. Let's just select at the end of the day. You understand? It could be that they have so many people, and they just don't have an option than to just select a few out of the so many. It could also be the fact that they already have somebody for that position, and they just wanted to officially make it open. Yes, it's not like a very good thing, but it does happen, you know. But it's just a way of encouraging you that it might not be the fact that you are not competent enough. It could be that you are not competent enough, but it could also not be the fact that you're not competent enough. So the only way you can know at times is for you to ask them, like, oh, could you please give me a feedback so next time I'll know how to prepare better in case of next time and all of that. So it's very important. So welcome again to, I think this is our sixth section of interview. And please, the last interview that we did, we weren't so happy because it wasn't we had to keep pushing people to speak. And this is a free live section. No one is paying us for our time. YouTube is not paying us for our time. We are just doing it out of our own free will. And we expect that since we want to help you, you should want to be helped. Okay, so let me reiterate this again. We expect that we want to help you, so we want you to act like you want to be helped. So if you're being asked a question, if you're being asked to give an answer, let's have this competitive spirit of wanting to give that answer. It's very important. It encourages the person speaking, because it's not good that I'm just speaking and speaking and speaking and speaking and speaking and speaking and speaking. It makes no difference, you know. Because what's the difference? I can just pick my phone and call you and just tell you all the story. You can just read it online, because there are so many videos and write-ups online that you can learn from. All right. So let's try and make this session much interactive. Okay. Now, interview, like we've said before, and we have said in other interview videos that we have all done before. You want to say you want to have a successful interviews, there are preambles that you need to ensure that you have put into orders. Okay, I will encourage you guys to watch the other videos we have done, and I'm also going to share this on our group. Okay, so that in case you haven't watched this, so that we'll have enough time to focus on more practical questions. All right, so I don't want to go through so much preambles, but the preambles that I'm just going to highlight is the fact that make sure you are conversant with the apps that you're going to be using for your interview. The Teams app is one of the major app that lots of international organization uses for interview section, or the Google Meet. So make sure you're conversant, practice with your friends, practice with your family for that, and make yourself prepared. Make sure your environment is calm, your environment isn't too busy, and it's, at least if you can blur your background, fine. If you can make it just calm and suitable, not too much, just something that looks reasonable, even plain, it's fine. Okay. Also, make sure that it's not noisy, because nobody, and I repeat, nobody likes a noisy environment. Nobody likes the fact that you want to speak to somebody, you can't hear the person. That's not good. Make sure you have a good working phone. It's not at that time that you should be saying, I want to go and charge my phone. Make sure your phone is fully charged for this process. Okay, that shows preparedness and readiness. Make sure you have good network. I know at times some countries do not have good network, but make sure that you have good network in the environment. Okay, try to test. I mean, if you are living in that environment, try to test, is it working? Is there a particular place that is quiet that fits all these requirements? And if I go there, I can be able to give my full attention, because it will not only distract the interviewers, it will distract you yourself. So you have to ensure that you try as much as possible not to cause any distraction for yourself and for the interviewers as well too. Okay, so anything that you can use to reduce noise, anything you can use to ensure that every other thing is in good state is very important. Try to smile, or try to be comported. Like, if you know, smile. Some people have a defense mechanism of smiling, like myself. If I'm scared of something, all I just need to do is to smile, and my smiling, that's all I can use to make myself feel confident. So if it's smile, but just don't put too much of a straight face, like, because it means you're building tension in yourself. Okay, at times just feel free to smile and do all of that. Okay, and then try to be polite, use the word thank you. Oh, okay. Oh, all right. Oh, thanks so much. Oh, thank you for that. It's always important that you just show courtesy, and it makes people feel free when they're speaking with you, and make the communication between both of you flow easily. So those are some of the preambles that we stated before. And although we went detailed into and give so many examples of how you can get all of this ready before your interview, so you can watch all of that. Okay, so now the major question, one of the questions they normally ask, or it's you introducing yourself to them. Although these days we have observed that at times some interviewers might not go direct to ask you this question, but they might go direct to ask this question, or they might go in other way. They can say, oh, can you tell me about yourself? Okay, or you can go another way. Oh, so what do you know about being a nurse? Okay, as a person, what have been your experience so far as a nurse? So they can go in any way. Okay, at the end of the day, it's for you to understand the question before you give an answer. It's for you to be able to say, okay, please can you come again? Or can you explain? I really do not understand the question. And then they can explain what they want, what they need from you, and you can give the answer to that question. So now, tell me about yourself. It's one question that we love to start with because it's one question that talks about you. And if you're able to give an answer to that question, it makes you confident when answering other questions. So on that note, I would like to hear from somebody. Please, can you tell me about yourself? Thank you. So that we can be able to, and not only is the person going to speak, the person is also going, other people are going to listen to the person, other people are going to jot corrections, and also other people are also going to speak or they tell me about yourself. So can you tell me about yourself? I don't want to start pointing people and say, tell me about yourself, tell me about yourself. So can you tell me about yourself? Thank you. Who is speaking? We've got Abimbola, Anne, Blessing, Bridget, Chisum, Uju, iPhone, Joy, Ola, Stephanie, Zoom user, Nina, Oluchi, and Precious. So we've got at least up to 15 people here on this Zoom call today. So could one person please unmute your mic and tell us about yourself? Let's see. I mean, you've got to speak now. If this is an interview, okay, hello, my name is Stella, and I'm going to be your interviewer for today. So could you please tell me about yourself so we could know more about you? All right. So someone should unmute their mic and speak, please. Thank you.
Hello, good evening.
Thank you so much for being the first person to step. It's always scary for always one person to be the
Please,
first.
it's not that I know what to say. I don't know if you can give us guide of what to put there, or I should just try anyhow because I don't know how to answer it.
Just try. From there we correct.
Okay. Thank you for interviewing me. My name is Eukaria Ujuma Ezebube, a Nigerian registered nurse. I have over 8 years of experience. I am competent and a fast learner. I've worked in several institutions where I developed some of my skills. Fortunately, I've been opportune to be in a female surgical ward where I render services to women of child, where I render services to women who are undergoing surgical procedures like gynecological procedures such as myomectomy, hysterectomy. I've also worked in emergency for about 4 years, where we manage emergency cases of patients, some of which were accident victims and others, maybe a patient that was brought in unconscious due to either hypoglycemia, hyperglycemia, and the likes. I have passion for caring for people, and I believe I am compassionate. I respect my patients while caring for them, and I am empathic. In fact, I have good interpersonal skills, which I use to advocate for my patients as well as to relate with my colleagues while at work. If I don't know, thank you.
You were doing so well. Why did you want to stop? I was actually enjoying what enjoying the way you were going about your question. One thing I really enjoyed was the fact that you were talking at your pace, and you were quite calm, quite relaxed, quite clear, which is very important. And you were communicating and passing a message. Another thing I
Thank you.
could get from you is that you were confident and you really know what you were doing. Like, you really know that this is me. So, I mean, this is what I do. So there's no need of me faking it. And there was no form of fakeness. There was no form of maybe you are reading. There was no form of maybe you have crammed it. You were just natural. Okay. And that's
Thank
so, and those are things that when you are preparing for an interview, are key that people do not understand. You don't need to be fake, although some people tend to have to cram for them to be able to comport themselves. If you're among those type of people, that's fine. Another thing is, I would like to ask you, what specialty are you actually getting? Do you have an interview with? What specialty? What units?
I am a midwife, but my work experience, because I think I didn't even arrange my CV well. Let me tell you, my work experience, I worked in the same hospital for about
No, no.
7 years.
My question to you is, I
I'm
don't
a
know,
midwife.
do you
I'm a
have an
midwife.
upcoming? And hold on, please. Do you have an upcoming interview?
Yes, 29th of May.
Okay. So my question is, what units, what specialty, what units is it covering? Is it medical? Is it general? Is it surgical? Is it midwifery? What unit is it covering?
Hey, I cannot really say because I think the question may come based on my CV. I don't know.
But
That's why I
apart
really
from
come.
that, apart from that, you need to, but do you, since your interview is on the, you said 29th of this month, right?
Yes.
Okay. And that's like let's say 14 days or 12 days from now. I can't
Yeah.
remember how long it
Yes.
is. So
Yes.
meaning that at least I don't want for the sake of privacy, I don't want to
Yeah.
ask what's the name of the hospital. Okay. I'm asking you what is the units, like, for example, if you are going to apply for, if you're having an interview, the job position you have an interview, maybe it's is it a medical ward, is it a surgical ward, is it A&E? So what unit, what position are you going for? I know it's a nurse job, but what units? Do you have an idea?
No, no, because it's by this AHS. So,
AHS. Oh
yeah,
yeah, now you're explaining better. So it's
yeah,
Alberta Healthcare. Okay, 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 okay.
yeah,
That's fine. That's okay. That explains it better. So they could put you anywhere. They could put you anywhere
yeah.
because it depends on where your skills lay in. Okay. But also one thing I know about AHS is that there are some certain skills as well too that they would like you to have. Like, there's a particular lady, was I listening, watching a video or something? So she was talking about herself and then talking about surgical, all of that. And she felt that they were not interested. So she was like, they were not like too copying. Like, yeah, probably they had lots of general nurses already. They wanted
Yeah.
something, maybe you're trained for them for you to show them a specialty that you have. And then she now said, okay, yeah, I also have midwifery certificates, so that piques their interest. Oh, yeah, okay, she has midwifery. Okay.
Okay.
So, and they actually put her in the midwifery section. All right. So that's the same AHS to that you are going, and she's currently in Alberta as we speak now. All right. Because I was
Okay.
making like lots of videos on Alberta. So it's good. The way you went about it now, it's actually good because it's not specific on which particular unit you want. As I mean, it's those that's the hospital already have a specific unit of which particular place you want. That's fine. So now that they invited you for the AHS talk, did they give you any documents of their essential skills? Did they give you any document of what they are expecting? You know, when you have an interview and they give you an interview invite, they might give you some document that shows the job description, the person's specification. Did they give you anything like that? Any document like that?
Yes, through their job search, I was able to find out the requirements. They're doing also what they wanted from from the nurse. They will uh,
Just hold on.
request.
What you do, attend to your baby first. Attend to your baby.
Thank you. Thank you.
All right, okay, that's fine. So let's listen to someone else. So while she attends to her baby, um, so one thing about AHS is that at times they have some specific things that they are looking for. Okay, and what I wanted to confirm is if they have sent you anything at all that will make you want to read about that thing and know what they are expecting, and also if they gave you a document of the kind of job role, just like you said that, yeah, you went through some searches and all of that for you to get such things. Okay, now when you're able to have that information, especially maybe a person specification, the type of person they are expecting, what I call a job description, the type of job that they are expecting you to do, it enables you to tailor your interaction towards what they want to hear. So the fact that you introduce yourself, you've introduced your name, introduce your specialty, and introduce where you have worked. Let's say you've worked in surgical, which is good. You've worked in accident and emergency, so you have experience there, which is a plus. You have an experience in midwifery, which you're supposed to add. Make sure you add it in terms of your interview. Do not leave any stone unturned because you do not know which particular unit will favor you. Let's say you have experience in oncology
Okay.
now, all right? And who knows, they might be looking for oncology
Yeah.
nurses. So if you say, okay, I'm someone that has I've got experience in different fields. I'm a nurse of, let's say you're over 5 years or 10 years or 15 years. I'm a nurse of 15 years and I've worked in accident and emergency units, which I worked there for over 10 years. I cared for patients that had issues like maybe that come in with low blood sugar, unconscious patients, and we've done CPR and all of that for the patients. I've taken care of patients in the surgical unit, those that have post-op, pre-operative patients, and I worked in that particular unit for about maybe 5 years or 3 years. I'm also someone that went further to learn about or also worked in midwifery section because all the experience I've gained so far started gravitating me or pushing me towards the midwifery side. I found out that I had a passion for that environment, and so I started working towards that unit, and I'm currently working there. So you talk about, you don't need to talk too much, but you are telling them the important things that they want to hear. You've worked in that unit, and you mentioned maybe 2 cases that you've actually looked after in such unit. Don't need to go too much into details, or you can just give a brief talk like that. Okay. Now, we've talked about your
Okay.
experience. We are moving forward to the next part, which is what you did. Just mute yourself for a while, okay? You're moving forward to the next part, which is what you did. Okay, I'm someone that is highly compassionate. I'm someone that loves to care for people. And then you talked about how you go on and beyond caring for people, how you also have good interpersonal skills, which you use in advocating for your patient, and not just advocating, but you also use this interpersonal skills in communicating with your fellow staff. So that skill is your interpersonal skill. You've highlighted, I have that skill, okay? And then you move further to maybe you talk about 3 skills. Maybe you want to talk about flexibility or communication skills. Maybe you highlight 3 important skills that maybe you highlight 3 important skills. Now, why I was asking you if they gave you any documents or if you've researched on anything was so that if there are some skills they have specified that they need, you can add those skills to these top 3 skills that you're going to talk about that you have. You don't need to, let's say they want someone that has good interpersonal skills. You don't need to go straight to say, I have interpersonal skill. You can just say, I'm someone that loves to relate well with staff because I believe in teamwork. That already tells them she has good interpersonal skills. Okay, so you highlight those points, all right, that they are need, what that the state they need. You highlight those points in when you are talking. So because you are already telling them, I am the type of person that you need. All right. Now, once you are done with that, you can go further to talk about any study you have done. Maybe you have certificate qualifications like I'm someone that has a huge taste for knowledge, or I always ensure that my knowledge in care or my nursing knowledge or the knowledge my healthcare knowledge is always updated. I try to go for seminars. To this note, I have gotten certifications in different phase of or different units. So I have certification in ILS, I have certification in CPR, I'm a midwife as well. I'm a general nurse, and I've got, you don't need to mention all the certificate in words. So that also takes you down back to those certain things that they need as well. So if you have those certificates, you can state that, and I continuously upgrade my knowledge. All right. I believe then, let's say they have a skill, like AHS maybe has a value or something. Let's say their value is respect, innovativeness, and kindness. You know, say I believe in the power of going on and beyond for people and always being creative at all times, always looking at what is wrong and see how you can offer your quota to the growth of the organization. And I believe that if you give me an opportunity to work with your organization, I can be able to use the knowledge in which I have gathered so far to not just only improve the care of this organization, but also the care of the patients rendered. I will be creative, I will be innovative, I will work with the goal of this organization, and I will also ensure that while I'm rendering the care, I maintain the standard and the degree of care being offered by this organization. All right, so that can be your closing remark when you are giving your statement. So that takes you to, you have broken your tell me about yourself into different paragraphs, but you have not spoken too much, but you have talked about the essential point that is needed. Because at times you might talk a lot, but you might be talking out of points. And it's very important that you do not talk out of points when you are talking about tell me yourself, because tell me yourself is an opportunity for you to sell yourself in this situation. Okay. So now I talked about your introduction, where you introduce yourself, where you talk about what you have done, where you talk about your qualities, where you talk about your knowledge, your skills, and maybe you've gone to advance yourself, or maybe you have masters, whatever. You talk about that. Talk about you now finally integrate yourself with their organization. You don't need to say, my goal and your goal interact with your nothing. You can just find a way to use the word to integrate using different synonyms of what they want as an organization, what their own vision is as an organization. And you can integrate it with your own vision as a person towards the end, and then use it as a closing remark when you are completing the words of tell me about yourself. And that is a seller and a selling point for you. So now that I've explained that, she has done very well. I would need somebody else to tell me about yourself. Thank you. One more person, please. Thank you. So who is going to
thank
try?
you very much. I would like to talk.
All right, go on. Go on, I'm listening to you. Are you still here? Can you guys hear me? Let me be sure that you guys can hear me. Can you hear me?
Yes, I can hear you. Good evening, ma. I can hear you.
All right.
Yes,
so,
we can hear you.
All right, thank you. So can someone tell me about
Nena.
Yes, ma'am.
Okay, thank you very much for giving me the opportunity to be interviewed by your agent. I'm a registered nurse midwife from Nigeria.
Okay, seems the network is not very strong. Can someone else with a better network speak? Speak now so that we can
Yes,
correct.
ma'am. Let me talk about myself.
All right, go on.
Okay. Good evening. Once again, my name is Ijoma Ndukwe. I'm a registered nurse. Sorry, let me start again. Good evening. My name is Ijoma Success Ndukwe. I'm a registered nurse with extensive background in the field. I have worked with various multidisciplinary team where I've acted as an effective member of the team. I love self-growth, so I've gone for several career development programs. I've attended seminars and workshops to develop myself. And I've also referred my colleagues and team members to CPDs where necessary. I am loving, caring, I prioritize care of my patients. I am courageous and compassionate. I'm committed to provide quality care that is safe and effective. I'm also competent to carry out all the duties and job duties and
Can I
job
tell
duties
you to start
ascribed to
again?
me.
Can I tell you to start
Okay.
again?
Yes, ma.
And while you're starting again, just relax. Okay, relax.
Okay,
Don't
ma.
be tense. Just be you. And I really want to know you as a person. Okay.
Okay.
Because I didn't really understand where you work when you were speaking. So I want to know you. So tell me about yourself. Tell me about your work and all of that. Let me, like the first lady did. You don't need to talk too much. Just talk what we want to hear, but at least make sure that you are not missing the important points while you are thinking about other points. Just let it flow. So tell me about yourself.
Okay, my name is Ijoma Success Ndukwe. I'm a registered nurse with extensive background in the field. I schooled at St. Luke's College of Nursing, and I have had 2 years experience currently in the field. I have worked with various multidisciplinary teams where I've acted as an effective member of the team. I've worked across community, clinics, and hospital, and I've gone for several home visitations as a community health nurse. I'm a certified teacher. I can use several teaching methods like the interview method, question and answer, in as much as my message is being passed when I work as a health educator. I love self-development, so I've gone for several CPDs, and I've referred several of my team members for CPDs where necessary. I have keen interest in the community, and right from my school days, I've been holding up leadership roles where it has equipped me to have leadership skill. I'm able to delegate effectively, and I have good knowledge of my IT. I've undergone mentorship when I was practicing as a nurse, where I've learned several skills that I know will equip me to be a better nurse in this role. I also have I have good communication skill. These have helped me to advocate for my patients and raise safeguarding concerns where necessary. I have good professional curiosity, and this has helped me to fill in gaps in the community where necessary. I have good knowledge of clinical governance, clinical auditing, and safeguarding. I'm able to raise concerns. I'm able to raise alert for my patients, and my patient's well-being is my topmost priority. I love extending the good hands of the profession outside the nursing clinical areas to my patient doorstep, in as much as my patients will feel loved and cared by providing a care that I'm accountable for. I am respectful, I'm loyal, I'm dependable, I'm able to work without supervision, and I have been able to mentor several student nurses that have been posted to my unit as a registered nurse. During the course of my practice, I've been awarded severally. Like last year, I was awarded the best nurse of the year, and I was also recognized by the Minister of Health in my locality because of I acted as a nurse educator during a seminar where I advocated for the girl child against male child favorism. Thank you.
All right. Thank you very much for that. Now, the role that you are going for, right? That job we are going for, what
Yes.
specialty is it?
Is a community staff nurse, health visiting.
Okay. I noticed it's community related because you were trying to always push yourself towards the fact that you've had experience in the community. And
Yes,
that's
ma.
fine. I know that's what you're trying to achieve, okay? But
Yes, ma.
hope you remember, the person specifications and the job roles. That I also noticed you were trying to cover all the person specifications
Yes,
and all the
ma.
job roles. I noticed, okay, I was noticing, but the only thing is that while you were trying to do as much as possible to cover it, you were not convincing me when you were speaking. Okay. That's the only thing. The only thing
Okay.
that can actually cover you
Yes.
in that sense is the fact that maybe they ask you other questions. So can you tell me whereby you've demonstrated a situation whereby you've had how you've gone for health visiting? Can you tell me the day-to-day activity of a health visitor and what they have to achieve? You told me
Yes,
you've
ma'am.
worked in the community, but I don't know what medical condition you've managed in the community. I never got an example of what you've done there, what patients you've
Okay.
seen. I never got a feel of what you've really done, you understand? Which
Yes,
is
ma'am.
one thing. Another thing also, although I also do not want you to go into details, because when you say this, the problem is so many people tend to start saying, okay, there was one time, and this is not the time for you to give that example. Okay,
Yes,
this is
ma'am.
not the time for you to start saying there was one time I helped people, and then you now start telling them, no, it's when they ask you, can you describe a time that you need to go that way, okay? But that
Okay,
doesn't
ma'am.
mean that if you are telling me that I have extensive experience in community, in health visiting, does not prevent you from saying that because I've managed patients like, because most people with this people have cases like diabetes, hypertension, wound dressing, and I've been able to manage people with all these complex situations at home. I always believe that healthcare do not just stop at the hospital doorstep, but it also continues at home. And that has always been my value and my goal, to always see these people that we have discharged home, how are they being taken care of? And that was one of the interests that pushed me towards community health, always taking care of them at home. These are
Yes,
ways
ma'am.
to show that. Now, what I've said, I haven't talked too much, but I've let them know, like introduce them to my person. Do you get what I'm trying to do?
Yes, ma'am.
If you are getting what I'm trying to do. Because at some point you were trying to go, okay, I have interpersonal skills, I have there was some certain skills you mentioned, I can't really remember, but you just like you were just mentioning the names of the points, like advocacy, what was the name? Interpersonal skills and some of them. But you could have used another way to show that you have those skills rather than just stating them, because what differentiates you from another person that is saying the same thing that they've already read from their system?
Okay.
I don't know if you understand what I'm saying.
Yeah, I
Because the one
understand,
that
ma'am.
did an interview and then they gave her a reply like she asked them for why they didn't give her the job, and the reply they gave was that we felt you were just telling us what you read from the system.
Wow.
Okay. So that was the reply they gave her. Okay, so
Yes.
yes, it's important, but it's always important that while you're trying to go everywhere, it's best to just have like maybe 4 skills or 4, because if you look at their job description, you could see where they put essential and desirable. So
Yes, ma'am.
especially those essential skills, you can use those ones as your major key points when explaining. Yes, if there's enough time and you can see that they are interested in you, right? You can
Yes,
start
ma'am.
talking about more skills, right? Because you can see their interest. You will notice when someone is interested in you with the facial expression and like,
Yes.
oh, okay, tell me more, so then you can now start busting out into doing so much. You get ahead.
Yes,
For
ma'am.
at that point whereby you are talking, it's always good to, number one, have an organized plan of what you want to say and what you want to do. Okay, so look at, okay, yes, they need me to have this. And another thing I like, let me commend you as well, is the fact that you mentioned education. All right, so you mentioned education,
Yes, ma'am.
but the thing is, you mentioned education one, then you talk about one, you mention education again, you talk about one. You're just like everywhere. You understand?
Okay. Yes,
You don't
ma'am.
need to be everywhere. Once you've mentioned education and maybe highlight 1 or 2 points on this, move to the next skill. So you don't need to be everywhere and you're not really giving points. I don't know
Okay.
if you understand. So,
Yes,
like
ma'am.
when you say tell me about yourself, your introduction went well. Okay. The only part I faulted in your introduction was when you didn't at least tell me what you've managed, maybe, or what you have seen, maybe 2 condition or 3 that's popular. And you cannot, so
Okay.
that it's not look as if that's the only thing you manage. But say, and so many, I've got extensive experience in other medical, like at home medical kind of thing, you can just, those ones are just like example of what you've managed at home. Based on, if you look at the job description, they'll definitely put the type of
Okay, ma.
so you can just pick two of those job description condition they put on that their job description, because you need to go and read their job description and just talk about, say, okay, I've managed those situations and so many more. You get, so just use
Yes,
that.
ma.
And then you also talk, then let's say if you are now moving forward towards talking about you having I think you talk about the fact that you have, apart from the skills, you have you have training or certification. Do you mention anything like
Yes,
that?
yes. A
So
teaching certificate.
a teaching certificate, yes, and I know that they need someone that knows how to teach. Okay,
Yes,
so
ma.
that's fine. That part of you introducing the fact that I have teaching certification in this part. In that part, you can then introduce the fact that you have taught in this and advocated for this. Okay, rather than
Yes,
waiting
ma.
to the end to talk about that. Why are you talking about, oh, okay, the next part? Yeah, it's good for you to have a plan so you don't go everywhere, okay? You know that
Yes,
I'm finished talking about my job description. I've talked about what I've done, people I've managed. My next stage is talking about my certification. Okay, and which is I've got teaching certification. Apart from my nursing degree, I've got teaching certification. I'm someone that I've advocated for the girl child. I'm someone that has also taught people, both junior mentors and senior mentors and all of that, you know. I've
yes, ma.
gone through all of that. So you don't need to talk too much, but you highlight that point highlighted. Then you now move for the next part that your skills, talk about some skill, all the many skills you were trying to bombard together, right?
Yes,
Ahead. You can just try to put like maybe 4, okay? But you don't just say, I have advocacy. You can like, oh, I try as much as possible to, you can still use advocate to advocate for people or to speak up for people, especially in cases whereby they can't speak for themselves, because I believe in always standing up for my patients, okay? That's already
okay.
talks about advocacy, all right?
Yes,
You can just talk about, I'm someone that loves to be an advocate. I always believe in speaking up for my patients. Then they know that you understand what advocacy is. You are not just
okay.
saying it. Do you get what I'm saying? Yes, you
Yes, ma.
understand what it means. You're not just saying, I'm someone that does that. I know what it is. I'm someone that believes in the power of it. I'm someone that's got good. If you want to say, if you want to put the interpersonal, something like that, because I always believe teamwork is the best. I mean, how can you achieve a goal if there is no teamwork? That is like bam. That blows people's minds. You get it blows
Yes,
their mind. Because they are saying, like, you're not just saying it, you are just saying, yeah, like I cannot imagine a work without people working together, because I believe that is the way we can achieve the goal of the organization. It makes them say to them, I mean, yeah, this person knows that. She knows, she's not just saying, she's speaking from the vibes, like from her soul. You
yes,
understand? So that
yes.
gives them that thing that yes, you're not fake. You get. And also, when you want to, one point I also like is the fact that you talk about your achievement, them giving you they gave you a
The best
certificate
nurse
of
of
one of the
the
best notes of
year.
something. Maybe you can also, you don't need to leave that hanging. You can add it to a fact that I'm someone that is caring. I'm someone that go on and be for my patient. Recently, I won the best award for being the best one because of how I normally go on and beyond for my patients. That marries and seals the point of caring. So in that
Okay.
way, you have not just only talk about you're a caring nurse, but you have also let them know that you have even achieved things as a caring person. But that doesn't mean that all we have said, you should talk forever. Okay, that's why I
Yes.
said having a structure on how you want to go about this, and maybe highlighting like in your qualities, maybe 4, and then your certification, and maybe you want to give it however you want to give your closing remark, just to sell. Your closing remark should always be something that is selling you and standing you out from every other person. So how you want to do your closing remark also makes the difference. Okay, so it's very
Okay, ma.
important that you do that. So thank you very much for trying. It's
Thank
nice
you, ma.
that you tried. Okay, so Do anyone have a question before we leave this section? Maybe you're like, okay,
No,
how would
please, I
I?
want to ask a question.
All right, go on.
Okay, please, is it the same question? Like, tell me about yourself and tell me about your skills and experience and how they can benefit this role. These two questions, are they the same?
Well, understanding the question is very important. So tell me about yourself. They want you to know it can be related, okay, but it can also not be related because of the last clause that they asked in that question. They say, tell me about yourself and your skills. It's the same thing as tell me about yourself. But they added a clause at the end. The clause is how it can benefit this role. Okay, that's the clause. So while
Yes.
you are telling them about yourself, right, you should also add at the end of your conversation, which is the part that you know that they are very interested in. It's not just only about yourself they're interested. When you look at that question, you understand that how it benefits the role is what they also are interested in as well. So if you're telling them about yourself and that you're a nurse, you must have understood the job role that they are asking you about. How will benefit the role? If you are going for a community health nurse, like the other lady that was talking, she has skills in the community settings. You understand? She has
Yes.
teaching skills as well. How it will benefit the role? She's bringing her teaching skills to them. You understand? She has worked in the
Yes.
community, so she's not new to it. She's used to seeing people in the community. She's used to caring for people in their home. So I believe me bringing my skill will benefit you, because what this role requires is someone that has worked in a community setting before, and I have done that. So I believe my skill will be benefiting the role. The skill requires someone that has educator certificates and all of that, and I have that. I have the qualification, I have the skill, and me having this and bringing it to this organization will benefit the role. Okay, the role also needs someone that has skills in taking care of people with different sort of medical condition, and I have that. And me having that, meaning that it will not be hard for me to adapt and adjust to the policies of this organization. And so having that and me stepping in is going to benefit the role. Do you understand?
Yes, ma'am. Thank you. I also have another question. When they ask
Go on.
you about tell me your skills and experience, do I have to start stating my experience like I'm going for a mental health role now? Do I have to start stating that, okay, first of all, I worked in the community as a mental health nurse, then I worked in this place, I worked in that place, like step by step, the experiences that I've gained from each place is the skills that I've gained and how those experience and skill will benefit the role, like step by step, or I should just put everything together. Because if I start explaining them one by one, I think maybe time consuming. I don't know if they'll stop me and say it's enough or something. I
All
don't
right.
know.
So, like I just spoke to that lady now, right? It's very important that when you are asked this question, then for someone that is a mental health nurse and they ask you, tell me about yourself, okay? Now, from what you've said now, meaning that you work mainly in the mental health setting, right? Because you mentioned community,
Yes.
mental health, and all of that. So it's at the end of the day, it depends on
Yes.
how you are presenting your words. Okay, like me, I like once, yeah, before I forget, let me mention this part. If you're someone that have just 2 years experience, you don't need to say I have 2 years experience. At times you might have people that have 10 years, so let's not be a disadvantage to you. But when you have like from 5 years above, you
Yeah.
can start mentioning that. So don't need to mention your don't state 2 years. So let me just put that out so that people will remember that. Okay, so let me go back to your question. Okay, so now
Okay.
for someone that has mental health experience, right, you could start by, after introducing
Yes.
yourself, then you can go straight to say, okay, well, I've worked in different mental health settings, both in the community, both in the private sector, and both in the public sector. And in these various sectors, I've taken care of people with various medical conditions, which include at least 3 or 4, and that's it. You've talked about it.
Okay. Do I need to talk about the management process? How I was able to manage
No,
them briefly?
no, you don't need to talk about the management. You don't need that. You don't need that. That's not the
Okay.
stage you talk
I should
about that.
just mention the condition. Like I should just mention like
Yes,
schizophrenia, mania, just Okay.
Yeah,
Okay.
yeah, you can just mention that. Do you need time? Maybe
Okay.
you want to mention maybe certificate or maybe skills. You can say I've got skills in managing patients. Such skills like in-depth assessment of my patients, in-depth therapy planning. You receive a request to record to cloud. You will not be able to
Okay.
record this to cloud though, because there's no space on this something. Because there's no space in our Zoom, so that's why you won't be able to record to cloud. If not, we would have recorded to cloud. But don't worry, we'll send you the recording after this particular video. So like I was saying, but the section is recorded. So let me come back. What was the last statement I made? What did I say last? I can't even remember now. What did I say?
You were
Oh,
telling me that I don't need to mention, or I don't need to state the management of each mental health condition that I have
exactly. Yes, you don't need to
experienced.
state the management of each stuff when you are saying, okay, I've managed, this is how I manage, this is what I no. What you can do is, right, when you have talked about your like I've worked in various settings, I've managed patients with all these conditions, you understand. You can then add like
Yeah.
what you can, even if you want to add, you can say, okay, I try to ensure that I use quality assessment, quality planning, intervention, and all of that, or quality therapy and all of that when managing those patients. You don't need to go in depth. All those things have a full words. I don't know the full words. I know they comment out. You have therapy, you have assessment, you have you know them now. All those, all of them up to 4 or 5 or something like that. So you can just say, when managing this patient, I use skills like in-depth assessments, call oh Holy Spirit. But do you get the point I'm trying to make anyway? So that it's not looking as if
Yes, I get the point you're trying to make.
you can just say, when managing these patients, I try to ensure that I use in-depth assessment, I use therapy techniques, I use this, that, and I use that. Maybe mention like 4 when managing them to ensure my patient receive the best care they can ever get. Full stop. That will not even take up to 1 minute to say. You understand? You don't need to start saying, when a patient come in, I try to look at them, I check them, I speak to them, I do this. No, you don't need to start even saying, this is how I manage schizophrenia, this is how I manage somatic disorder, this is how I manage this disorder, this is how I manage you don't need to go into depth like that. No, you can in a way summarize it, right? But summarize it in a way that's like I said, I've worked in various settings, community, private, public, and now I'm currently working in this. Within this period of time which I've worked there, I've taken care of people with different medical conditions, which includes this, that, maybe 3 or 4 is fine. And when doing that, I try to ensure that I use several skills. Such skills include assessment, therapy, this, that. 4 is okay, full stop. Okay, then you can now move further to talk about other skills that you have, all those other skills that they need. They definitely, as a mental health person, you need to have safeguarding, communication, and some other important skills that they need and safeguarding and advocacy. They need you to be able to have some of all those important skills. Yes, so you can mention maybe 3 or 4 of that. You don't need to talk too much of how you have some of all those skills and kind of personalize it like the way I was telling the other lady. You don't need to go into details, but you can make some statements like, I always believe in always advocating for my patient, because I've seen situations whereby this happens to some patients and they're not being a favor, and I've always tried to make sure that I make the difference when doing that. Full stop. You move to the next point. Okay, so at the end of the day, it's about you just organizing yourself, being calm. Don't go too much into details, but make sure that you are highlighting the points that they need and bringing yourself into the points. There should be a difference between you, okay, and the next person that is saying the same thing that you are saying. All right. That's one thing you should always keep at the back of your mind. There should be a difference between you and the next person that is saying. Like now, in this particular place now, many of you are listening to me. So people too might be watching this video. You guys might be going for the same position, the same mental health position. You guys are competitors to each other already. So why should I take you and not the other person? The other person said he has communication skills. You say you have communication skills. So why should I take you? It's the way you present yourself when you say you have communication skills. I go on and beyond to ensure that my patient understands what I say. That already differentiates you from the other person. Okay, I use different communication skills like listening, and you don't need to go too much details, like listening, even use of writings in case whereby the patient needs other additional support in communication. That already differentiates you from the next person. Okay, I'm someone that loves to, I've always used interpersonal skills. I'm someone that always believe in the power of working together with people and also communicating with people, family. That already differentiates you from the next person. I'm someone that ensures that safeguarding is done. I'm someone that ensures that things are being done in the right way. I'm very dedicated, attentive to details, because I believe that the tiniest points you can miss can be the thing between you and the patient's recovery. That differentiates you from the next person. Do you understand? Are you getting, like,
Yes, I
you are
understand.
saying something, but you are bringing in why you are saying that thing. You don't need to go too much into details, but you are personalizing that statement, that skill you are saying, you are personalizing it. I'm someone that is flexible. I've worked in so many areas, and so I believe that if I'm sent to a new place, I can always adjust. That differentiates you from the next person. And that does not even take up to 2 or 3 minutes to talk about. And you only need to just talk about, maybe highlight like 4 of those essential skills, and you are good to go. So that you don't need to talk too much. Because when you talk too much, you might talk too much and not talk the important points. Okay, so that's just what I'm trying to explain. Hope we are all clear now. Tell me about yourself.
Yes.
All right, thank you. All right. So now, once we are clear on tell me about yourself, okay? Now let's talk about other questions that they might ask. Now, different questions are being asked depends on where you are working as an individual. Okay, it's one thing for us to start asking you, okay, tell me about the situations you were asking you. Although yeah, we'll ask you randomly about those questions, fine. But one thing I want you guys to know is that in an interview, they have different type of questions. Okay, they tell me about yourself is the part whereby they want to know who you are, your skills, they want to know what you are bringing to them. All right, that's one part of the question. They might not even go that way, they might go in another way. All right, they can tell you, can you tell me what's the day-to-day activity of a nurse or of a community health nurse? That also makes they want to see if you understand the job role that you are applying for. That's for those that already have the job role. For people that are going for AHS, like the first lady now, those ones you already know that AHS, they're not coming to test you. Yes, you need to also know AHS as itself. It's AHS goals and objectives. So you need to understand the AHS goals and objectives and the kind of people that they need in any AHS. So that is an assignment for you to make sure you browse on and do that, so that it makes you sell yourself. Because one thing already about jobs is that everybody is good. They just want someone that is best for them. Like now, before I came for this job interview, right, with you guys, I had an interview with one client that with someone that we're trying to bring into our company to work with us, okay? And we've had interviews before with other people. We were not satisfied, not because they are not good, but because they are not giving us what we want. There's something we are looking for, okay? And we have put it out there that this is what we are looking for. But you are not giving us what you're looking for. But the person we just had now gave us what we are looking for. So one thing you must always understand is that everybody can be good, but you need to know what those people are looking for so you can present yourself as that person to them. And don't make it too obvious that they will think you are just doing copy and paste, but make sure that you are personalizing it. So that brings me to the second question. When someone they're asking you, like the question this lady just asked me, can you tell me about your skills and how it's going to fit into this job role? That is one way. Okay, they could go another ways. what is the day-to-day activity of a nurse? Or what is the day-to-day activity of a community health nurse? I went for an interview for the role of a senior band 7, senior, a very, very senior role anyway, in nursing, okay? And the question they asked me was, can you tell me what is the day-to-day activity of this role? That's the senior role I'm applying for. And I told them, so you having an understanding of that particular job role and what they expect you to do and personalizing it, which I keep hitting because I could say the same thing, that person could say the same thing. The difference is how I personalize it. Okay, so you doing that makes the difference between you and the next person, and makes them know that yes, you have an understanding of what that job role is. Because if you do not have the understanding, what if they bring you to the job role and you don't fit it and you don't leave them? That means their resources, their time, their training is wasted on you already, and they have to start afresh. And no organization likes to start afresh again from the beginning. So that answers the next question, that in an interview they might ask you to tell them about the job role. In different ways, that question can be asked. Can also be asked, can you tell me what the skill of this particular type of nurse is? What quality do you think a mental health nurse should have? What do they do on a daily basis? So understanding that role is very, very important. So these are potential questions they can ask you. Another question they might ask you is when they now start asking you descriptive questions. Descriptive questions include, can you tell me about a time when you did this? Can you tell me about a time when you have demonstrated this? Can you tell me about a time when you have shown this? Can you tell me about a time when this situation happened and how you resolved it? Can you tell me about a time when you have conflict management? Can you tell me about a time this, that? Can you tell me all those questions that they ask you? We always tell people, I'm sure some people might know, but we always tell people to use the STAR technique. Okay? The STAR technique simply means, or let me first explain what those type of question means. Those type of questions are expecting you to explain to them, right, a situation or an example of a time something has happened, that thing they're asking you for has happened to you personally, because they believe as a person who is coming for this post, somehow in your field you might have experienced something like that, okay, and how you have been able to resolve it, or how you have been able to manage such a situation, or what happened in that situation. So they want you to tell them a story. Okay, that's what they want you to do. They want a story to be told, and it's at this point that you have to go in depth. You know, before I say you should not go in depth initially, but it's at this point that you need to go in depth. It's at this point you need to start talking about things that happen, going in depth. Now, when going in depth, it's also very important that you do not just go in depth and go haywire. You can go in depth and just like talk and talk out of points. Okay. So that's why that brings us to the STAR technique. The STAR technique simply means S for situation. You talk about the situation of the problem that is happening, or this stuff you want to introduce or talk about. It must not always be a problem. It's talk of what you want to talk about. The introduce the situation. What is happening? What is the condition? That's meaning of situation. Okay, what happened? That's a situation. The task. Okay, what you were going to achieve, what you wanted to do then, what you had at hand. Okay, what happened? That's the first question, situation. What's the task at hand? So what are you going to do? Or what were you going to do? What were you going to achieve? The task at hand. So the next is action. What did you now do? Okay, what was your action? What you did? You are going to do something. That was the task at hand. What were you going to do? How were you going to manage it? What was your plan? It's just like assessment, planning. What was your plan? What were you going to do? The action is now, what did you now do now? You wanted to do something. Okay, so what did you do? You understand? What did you do? That was what the act. That is action. Result. Okay, now you have done something. What was not the result? What happened after all your wish thing that you did? What was the result of it? What happened? Okay, so that is what the STAR technique says: the situation, the task, the action, and the results. That's the meaning. Okay, so now this enables you to answer any descriptive question at all that they ask you. You can be able to answer it. Now, another thing I want to mention about descriptive questions is that when you are asked a descriptive question, especially maybe they tell you maybe questions about maybe can you describe a time you made a mistake, or can you describe a time something happened? In that kind of situation, make sure, like we always say, make sure you talk about times whereby talk about things that will not put you into a tight corner. Like don't talk about medication error. Don't talk about things that put patient life at risk. Nobody wants to employ someone that puts somebody's patient life at risk. You can talk about a time whereby maybe when you were a student nurse, you understand, when you forgot something and how it has molded you to become a better nurse, that type of thing. Those are maybe those situations whereby you were still under learning process. You can talk about those such mistakes you get, or things like oh, there was time I didn't really understand how to operate an equipment. You understand? They brought a new equipment in the world, or an equipment was faulty. Those type of things are not something that will kill a patient. You understand? So those things are easier. Always look for the safe bets to give that answer when they ask you such type of questions. It's very, very important, especially in descriptive questions. It's very, very important. So I just wanted to put that out there when you are asking this question. So now that I put that out there, I'm just going to ask them. It's already almost 9 o'clock. So I'm going to ask some questions now. What question is this one? This one is from ODP. Is there anybody that is ODP here that is going for ODP position? If there's none, I'll go to the next question. Is anybody going for ODP?
Yes.
ODP. Okay. So, this one is not much, sure. Anyway, this was the question that okay, let me not ask the other one. So, questions that they asked this person is what do you do if you are to perform a procedure? What's the answer?
I would know the kind of procedure I want to do. Then I will assemble my materials, and I also identify the patients and prepare the patients for the procedure. So that will be my answer.
Right. You kind of covered what you do anyway, but I feel like you should have gone, maybe the other ways you could have gone about it. Probably say, yeah, you've mentioned about you having to assess the patients. Like first, you need to understand factors relating to the patient, like assess the patient, know if that's the right patient, go through the checklist of if the patient has filled the consent for the procedure that is needed to be done, go through with the patient if there are things that maybe there are some things the patient was supposed to avoid, like for example maybe eating before a particular procedure, or some certain things that they were supposed to avoid, and all of that. If the patient was compliant with it, you understand, before such thing, before the procedure goes. So you are going through a thorough assessment with the checklist. Is there anything the person is wearing that could be maybe metal, or anything that could be a hindrance to the procedure? And if the thing needs removal, is the patient fully identified? Is he wearing an identification label that identifies him as the right person? If there is a markings that was
Okay.
supposed to be marked on the patient's hand, have the right markings been done already? So those are factors related to the patient. Then also look at the environment. Is everything ready ahead of time? Is the machines up to date? Are they well calibrated? Are they cleaned? Are they working? You look at factors related to all of that. Then you also look at factors related to other healthcare professionals. Are they ready? Speak to them to know, is there a plan ahead of time? Is there things just so there? If I was going to ask that question, I would divide it into 3 factors. One related to the patient, no, 4 actually. One related to the patient. If the patient also understand the procedure that is going to be happening, factors related to the patient, to the environment, to other healthcare personnel, and factors related to the procedure itself. How prepared is everyone for it? The people around, are they competent? And is everyone ready to work together? So that's how I would have gone about answering that question.
Okay.
I'm not an ODPO, but I know that should be like the answer. Okay.
Okay. Thank you.
So yeah, so that's a way of, at times, right, when you are asked a question in terms of interview, right? I remember they asked me a question. I'm trying to remember. And then there's no rule in giving answers, but your ability to just say, okay, well, I'm going to divide this into some certain places, like factors or related to this, that. It makes me organized, So once I'm able to go through this checklist, I'm able to go through this next one, go through the next one, this next one. It makes me know that everything is ready and secured. So you going through all those things. In fact, the thoughts, many things as you are saying will just be coming through your head because you've already organized how you are going to arrange. Like if you ask me now, how can I prepare for an interview? I'll tell you factors related to you as a person, to the interviewer, to the environment, and to your devices. And those 4 points, I can break them down into so many points arranged. So me finish talking about one, I always remember points on the second one. I remember points on the third one. And by the time I finish, I've actually covered everything. That I don't think there's anything you want to ask me again. Okay. So now the next question they ask is, what do you do when you delegate responsibilities, and why is it important to delegate tasks?
Okay, so if I delegate responsibility, I would follow up. I'm going to follow up with the person. I'm going to ensure the person carries out the responsibility. And it's very important to, please, what's the second question?
Let me go back then. The question says, why is it important to delegate tasks?
Okay, it's important to delegate tasks because it will make the work go faster, and it also facilitates teamwork.
All right.
So, and okay.
All right, go on. Sorry, go on. I will cut you. Go on.
Okay. Yeah, and delegating tasks to someone is very depends on the strength of the person, what the person can do. So, and even though I've delegated the task to the person, I still need to follow up because at the end of the day, if anything goes wrong, I will be held responsible.
Okay, that's good.
So
Getting
I
always
think that would
mean
be
that,
my
yeah, delegating always mean that you should always follow up at the end of the day. And when delegating tasks, the person has to be competent to carry out that task. You cannot delegate a task to somebody that is not competent to carry out that. Make sure if it does not, maybe you can train the person a bit and make sure the person is really competent to carry out the task before you can delegate it to the person. So it's very important, and follow up. Good. For
okay.
those that are mental health, okay.
Thank you.
Can you, okay, that's fine, you're welcome. So for those that are mental, that doesn't mean you should go, because they could ask you other questions from other people questions. So that's just one person question.
I'm here. Okay,
All right.
thank you. I'm here.
All right. For those mental health, can you give me a risk assessment for a patient with suicidal ideation, domestic violence, and housing program? That's a tough question. That's good. Mental health nurses. Not plenty here. I think almost everybody here is mental health. Mental health nurses, answer your question. No.
That question is quite tough. That question is quite tough. Like, I don't even know what to say.
If it's you that they ask the question, what will you not tell them? That question is quite tough. It's just risk assessment now. Risk assess the person. How will you know a patient is at risk of suicidal ideation, domestic violence, and what housing program? That's what the housing program will mean. What implementation do you think that should be done for the patients with all of that in terms of the housing program and all of that? So you should give a shot. You never can tell. What you know might just be the answer. I'm not a mental health nurse,
Okay,
but I have answer already to this question. So you should not form my hand. Start answering this question.
Okay, in conducting a risk assessment, one just have to assess an individual based on maybe the symptoms the individual is presenting. So if an individual is at risk of suicide, the individual will definitely be presenting, manifesting some kinds of symptoms. Sometimes they may be expressing themselves to be overtly happy, but that does not really mean that they are actually happy. They may have a plan. And after conducting this assessment, what I'll do is that I'll implement strategies like maybe taking away harmful equipment from the individual, ensuring that the individual is always being monitored at all time. If the individual is at risk to not just themselves or they are at risk to others, I'll keep the individual in a place that will ensure the safety of other patients. If the individual is likely to be very harmful to himself, even with things that are within his environment, I can also restraint to be the last resort. Restraint. That's just what's coming to my head now.
You tried. I mean, you did well. Okay, you did well. So, is there any other person that wants to add their own quota?
Okay, let me try.
Hello? That's what I want to hear. Let me try. Oh yeah, go on.
Okay, let me try.
Don't forget, it's not just only suicide. There's domestic violence attached to it. Though, so that question.
Yes, risk assessment is very important in management of people with mental health disorders. For example, a patient who is suicidal, there's some evidence, there's some manifestation in a patient that you think that will make you to be on alert that the patient might be suicidal.
Exactly.
Sometimes you see a patient who is physically speaking about suicide, having talking down on themselves, or on the other hand, someone that have been very down, all of a sudden the person is just very calm, is cool, is everything, he acts as if everything is okay. There could be tendency that the person has already had pre-planned suicidal attempt and already have a plan on how to carry out the suicide. Also, there could be evidence of having harmful objects around the person, or person having harmful objects around them. There could be an evidence that the person want to use such to harm themselves. On the other hand, for domestic violence, for a patient who is a victim, who is a suspected victim of the domestic violence, there could be apprehension on the side of the person. The person could live in anxiety. There could be obvious anxiousness and anxiety on the person. There could also be physical manifestations such as scars on their body. There could be scars. There could be disfiguration of a part of the body, leg, face, or any part of the body. So If you assess a patient and you found out that the patient have some scars evidence, abnormal evidence, scars on their body, it could be an evidence that the patient is a victim of domestic violence. And if there is obvious apprehension, so in such case, you ask the patient, I would rather ask the patient calmly in a very calm manner, letting the patient know that nothing is I'm not going to hurt him or her in any way. Talk very calmly to the patient and ask what the problem is, and assure them that they'll get the best care, they'll get the right help they need to come out of the problem or come out of the situation. That is to ensure that the person is relaxed and able to speak about their experiences.
All right,
Yes,
thank
and
you.
after
Have you finished?
I wanted to say something
No,
else.
yeah, go on. Yeah, go on. I'm listening to you. I thought you finished.
No.
Go on then.
So I would also assure the person that the safeguard needs of the patient will be taken into consideration, and also make inquiries, make the necessary calls, or make the necessary arrangements for other safeguarding agents, social welfare that will also help the patient. I would inform him or her about all these now all these safeguarding procedures available that can help the patient, and housing program arrangement. I think I'm done. Sorry.
Very much. No, why are you saying sorry? Both of you did very well. I mean, someone should just combine your answers and give the answer like that, and that. I mean, you should be able to give a good answer with all you have said. So, in such situations, especially in a question whereby if you are hit with a question whereby you're like, oh my God, just like this. Okay, first thing, take a deep breath in and out. Okay. And so what next you do is, all right, I believe that, thank you very much for this question. I believe in every organization, there is policies and standards and steps that one needs to take in managing such situations. So if I am working for your organization, I will definitely follow the set rules and standard of risk assessment and also of management set by your organization to manage such situations. But currently, where I work at the moment, this is how we manage it. That removes them from their expectation of what they want in their head for their own organization. You get that already makes them know that, okay, so she's going to talk about it based on her own understanding of what they do. So for us to manage risk assessment, okay, the first thing you need to do is understanding who as a mental health patient, managing mental health patient involves assessment. And for you to assess a patient, you need to understand such situations and understand what it really means for a patient to have suicidal ideation and domestic violence before you know the interventions that you can offer the patient. So risk assess the patient. Yes, first and foremost, you also have to look at the first, apart from what you guys have said, which is listening to what the patient says. You can also see signs of the patient talking about suicide. Okay, you can also see signs of the patient who has been depressed for a long time and suddenly just become elated. That could be a sign when you are doing risk assessment of the patient, which is what you guys have said already. Another thing that could also help you is past medical histories. Okay, does this person have past medical histories of? That's one thing you guys did not mention, and I said I'm going to mention it. Okay, past medical histories. Does he have past medical history of suicidal attempts? Okay, someone that has had past medical history of that, you need to put the patient on a caution guide. You understand? Also, another thing you have to look at is for a patient that have past medical history, have there been scars on the patient's skin of attempts to commit suicide on themselves? How do they view life? So using good communication skills, communicating to understand the patient as a person, listening and observing the environment. So observing, is there any sharp environment? Is there any habitual character the patient possesses that puts the patient at risk? All this you guys have said and many more, are how you assess patients in terms of risk assessment, listening to them, both verbal assessment, both physical assessment of them, okay, using good attentive skills and observing their environment. It's very important, and also reading their past medical histories. Another thing you also for in case of domestic violence, which you guys have already stated, I didn't talk about it, is apart from looking at, you don't talk about past medical history for domestic violence, but you need to look at how is their factors related to the patient himself. Is there scars on their body? How are they? Are they timid? Are they always apologetic? Do they seem like someone that is always in fear, someone that's always anxious, scared of making mistake? Are there marks on the person's skin that like marks that does not look like maybe a fall, something that is in a weird place, that this is not a place whereby someone can have a fall that is related to just normal fall, Look at the interaction between the person and the family members. Is there something that is related that you could say this is a domestic violence happening to this particular person? These are ways you can assess the person, because you now add that in-depth assessment is key as a mental health person. Now, for housing program, for someone that is suicide risk, that for us to manage, we have to make sure we are safeguarding and doing the necessary referral to the social team, like she has rightly mentioned, to the mental health team, which you guys are, but you can also refer to the mental health doctors, the psychotherapists who can also involve the safeguarding team, who are also going to come into play to put an action to ensure that the patient is safe. Also ensuring that the environment, any sharp object or any stuff that can harm the patient is being kept off. Also making the team aware so that an extra caution eye can be kept on the patient to avoid any harm from affecting, and so many other management process that we can do in terms of housing, and also for domestic violence. That already answers these questions. Okay, okay, fine.
Sorry, please, I have a question.
Go on.
Yeah, for the housing part of the question, is it like risk assessment for patients that is in housing, that is in a housing program?
No, I think for my own understanding, if I'm in this particular situation, okay, and once I'm done asking the question of this domestic violence, what I will now do is I want to ask, so please, I would like to understand the part of the housing program. Are you asking me how I am going to manage such situation? Or are you asking me risk assessment for someone in a housing program? Okay. When you do not understand a question, it's always good to ask them to explain what they want, because at the end of it, you don't want to be giving off-point answer. Like my own understanding of this housing program is how you can manage them, like what housing program you want in place for them. But they could be talking about risk assessment of someone in the housing program. So it's very important that you clarify situations, okay? Yeah. So it's very important that you ask such question. Now, why that is said, let me ask another question, okay? The other lady has already asked this question that they say, why do you apply and what are you bringing to the trust? That's one way. Another question, they say, how will you manage pressure and stress at work, at home? That's an easy question to answer. I believe everybody already have an answer on how they can manage pressure and stress at home, so we're not going to talk about that. A patient messaging you on Facebook, what will you do? If a patient is messaging, first of all, how will you know that the patient is on Facebook and is your patient? That's the very first question. Okay. Now, you make sure that you deal with the patient in the most professional way. And depends on the content of what the patient is asking you, personal question, interfering to your personal space. You make sure you also report to your management team so that they are aware of what is happening, and show them all the evidence, and make sure you respond in the most professional way as you can. That's how because some mental health people are follow. They can go and research your history and start disturbing you on Facebook. So make sure that you have to report to your senior team. make sure you have to reply the person in the most professional way and all of that, and attend to the person in the most professional way, but make sure you also escalate it. And always draw the line in terms of conversation, okay? Always make sure that there is this line that is being drawn. And that's also meaning talking in a professional way as well too. Now, the next question is, what help do you think you will need when you are employed? Okay, no, that one you know how to answer that question. They had asked another question on team working. How will you work as a team? Describe the time you've worked as a team. So make sure you have an answer to that question, okay? Then care plan. How will you motivate a patient who is unmotivated? Okay, someone should answer that one. I think that question can be asked to anybody, not just mental health. Before you answer that question, they asked the question on a time I made mistake in my practice. And I've already talked about that how to go about answering that question. So we'll not go into detail. So this is a question. I talked about it without looking at this question. Imagine this person has practiced what I just said before going for this interview. And they asked this person these questions already. That makes the person prepared without even going for this, without even cracking their brain to talk too much. So now my question to you is, can you create a care plan for a patient who is unmotivated? Someone should answer that question. Anybody, this is everybody question. Can you care plan for someone that is unmotivated? I have few minutes here. I have a program with someone at 9. I've extended it beyond 9 because of you guys. So answer my question, please. Can you talk about the time where you cared for someone?
Okay, Ma, please, can I talk?
Go on. Go on.
Okay, is it like literally a care plan, or I should just talk about how I'm able to motivate someone
How you able
who is
a
feeling
patient?
unmotivated?
Okay, let me go this way. It's the same answer question anyway, but let me ask it in a different way. You resume work and you meet a patient that is unmotivated to do anything. So how will you motivate this person to be involved in the care, and also in care for their health, or in their care anyway? How will you motivate them for someone that is already unmotivated, does not have motivation at all?
Okay, the first thing I'll do is to validate that individual's feeling and show the person empathy. I'll let the individual know that yes, I'm there for the person and I'm willing to listen to whatever the individual has to say to me. I'm trying to build trust so the individual can like open up to me. So after I establish that trust, then I'll ask the patient, what exactly is the problem? Why are you feeling low? Why are you feeling less motivated? Like I can also from there I can deduce that maybe the person is feeling maybe stigmatized, like if it's a mental health problem, the person is feeling like, oh, I'll be stigmatized because of this challenge or something. Then after deducing or identifying the individual's challenge, I will now educate the person. Maybe if the person is just feeling like doesn't want to participate in his healthcare or doesn't want to seek help, I'll educate the person on the importance of seeking healthcare, on the importance of participating in the healthcare, like just generally educating the person depending on the situation. After providing education, and providing emotional support, I'll also involve the individual's family, like the person's loved ones, because family can be a great source of motivation to an individual. So after that, I think basically I'll just be patient and give the individual time. Okay, I'll also set small goals, for the individual to gradually come out of his or her low mood. Then just be patient, understand the individual, and give the individual time. That's what I'll do.
All right, that's brilliant. That's very brilliant. You've actually said everything that probably popped up on my head while you were speaking, and we've already covered it on how you're going to motivate someone that is unmotivated. Also, see why you are setting small goals in so that the person can gradually achieve because you can't just put up all the goals together at once. So step by step goal. So from small wins to bigger wins to make the person involved in their care. You try and see if there are any bargaining you could bargain with the patient. Let's say, oh, okay, why? Oh, if you're would you like to maybe do you want me to would you want to speak to your family, or do you want us to, is there a particular person you want us to bring in that you would like to interact with? Do you want to take a walk around? Such a thing can make the person also motivated in want to get involved, because they will now see that you are really interested in them, interested in how to help them, and that you are there for them as well. So that also helps. So you understanding them as a person, understanding their needs, creating that rapport, that trust, and all of that. Very kudos, well done. You've covered all of that. Thank you so much for that. So this one now was a question for community. I know there's one here that is a community person. A community staff knows, and then they asked some questions like, tell me about yourself was one of the questions they asked. And another question they asked was, explain the NMC 6Cs and how you will incorporate it in your duty. Oh, I remember this question that they asked me 4 years ago. It's very easy. Explain the NMC 6Cs and how you incorporate it in your duty. Can you just sing aloud the NMC 6Cs? Because you already know the answer. Who is going to sing aloud these 6Cs for me? Someone should sing it out, please. Let's move to the next one. Should not take our time.
Care, courage, compassion, communication, commitment. Care, courage, compassion, communication, commitment, and competent.
That's it. You know how to integrate it in your duty. You're a nurse. You should know how to integrate all of that stuff. We're not talking about that. So they ask another question: why should we employ you? Did you know the answer to this question? This question is, why do you think you are the best person for this role? So for you to answer this question, shall I for them? Tell them, you people say you need somebody that is this. Okay? That is where you are knowing the person's specification. You say you need someone that is this type of person. I have done this in this particular place. I have this skill. I've demonstrated this in this, that. So because of it, I will be able to fit into the role. You said you need someone that is this. Mention like 4 or 5 of the essential that they want. Tell them, explain to them how you have achieved this. Don't just say, you say you need someone that is interpersonal skill. I have good interpersonal skill. You say someone that you have communication skill. I have a communication. Well, that's not the way to answer. You need to go in depth, okay, and explain how you have achieved this, how you are the person, and when you are finished explaining to them why you are, how you have this stuff that they want, then you now say, with all this stuff that I said, I believe I'm the best to be employed for this role, and I should be employed for this role because I closely meet with the person's specification for this desired job role. Okay, so that's how to answer that question. So I think I've explained in other videos before, and I think I even gave an example in other videos of how they asked me this question before. I just related it to my recent experience at work. You say you want someone that has this thing, and I have it. I've done it in many. I had a patient that had this, and I went on and beyond. Talk. So I have the skill. I went to the next one. I explained. Simple. Go finish. You give the answer. But you don't need to talk too much. Like I'm telling you guys, I mean, you go in depth, but don't go talking everywhere. Make sure you have like maybe 4 that you want to highlight. Those, or 3 that you want to highlight. That's the essential skill they want. Tell them you have it. You people say you want this person. I am that person. I have done it. In this is where I have done it. In this place and this place I have done it. Okay, so employ me because it is me that I have done it. Okay, so that's that question. Why you should be employed. Tell us about
I
our
want to ask you a question as regards that statement you made. Now that question, sorry. I want to ask you a question.
Okay.
Okay. This and why should we employ you and why are you applying for this role? Are they the same question?
No, they're not the same question.
Uh,
Okay. Why you are applying for this role can be kind of related, but it's not totally the same question. Okay. Why are you applying for this role? Okay. You can say, okay, the reason I'm applying for this role, let's look for the role of a community health nurse. Okay. It can be kind of related if you really look at it. Why are you applying for the role of a mental health nurse in our community? All right, thank you so much for this particular question that you've asked me, right? The reason I'm applying for this role are related to different, I have so many reasons which I'm applying for this role. But number one is the fact that this role is a mental health nurse role. I've been a mental health nurse for a very, very long time, and I've demonstrated the skills. And being able to work in an organization that will enable me work in this service skill and still explore and grow further, all right, makes me want to apply for this role. That's one, but that's not very catchy. Okay. Now, why is the difference between this question and the other question is that why did you apply for the role could be that you could say that I've looked at your organization, all right, and I've looked at your organization. Your organization, you look for things about the organization, right, that is captivating. For example, you can say this organization is an organization that is interested in patient growth. This organization is interested in staff education. All right. And it's also a mental health position. And yes, I am a mental health nurse currently. But the difference between why I'm applying for this role is the fact that your organization is interested in staff growth and development. And it will push people, right, to want to develop themselves. And I've always been someone that loves developing not just only myself, but also other people. You understand? So that's the reason why I'm applying to your hospital and applying for this role. This particular role entails that's okay. Let me know. This is for why you apply to us, why you're applying to this hospital. Okay, this is one. Then why you're applying for this role is also different. So I will kind of go into that in answering this question. So you talk about the organization is someone that's also patient-centered, someone that loves to grow, help patients go on and beyond. All right. And so I'm someone that loves doing that. I try to imagine myself, what if I'm the one on the bed? How would I love to be cared for? And me seeing an organization that is interested in quality and not just only about care, but quality is one of the reasons why I am applying for this. So I've also looked at your values. This is where when they ask you why are you applying to their hospital, why you are applying to their hospital, right? This is where you're also looking at their values, the hospital values. And you are saying that this value, also I've looked at your value. Your value needs someone that it involves innovativeness, it involves kindness and respect. These are what I believe as a nurse everyone should have. Being creative or being innovative. In my organization, I have been creative and innovative. And I would love to work in an organization that encourages such healthy skills. Okay. So I would love to bring in my own quota of innovativeness towards your organization. And that's why I'm applying for this role, because it aligns with what I do as a person and it gives an opportunity to grow. And I can be able to offer my own quota to the world at large. Okay. The organization also is someone that has different people from different backgrounds. I've been caring for people in different backgrounds before. And so it will give me an opportunity not just only to care for the type of people I've cared before, but also to care for people on and beyond. You understand? So I'm someone that loves to give back to the world. And so for my it will give me an opportunity to give more to people from different parts of the world, give the care, improve myself and all of that. And that's why I'm applying for your hospital. Now, question of why you are applying for this role, or yeah, why do you apply for this role? Let's say there are some things they require for the role, like someone that they need someone that is a teacher. Okay, someone that has good teaching skills. You can say, okay, one of the reason I'm applying for this role is that let me give for example, when I applied for the role of a band 6, they asked, why are you applying for this role? Okay, I understood what the role of a band 6 is, and my answer was like, okay, this role actually entails someone that um teaches people, someone that is ready to mentor the upcoming generation. And over time, as a nurse, I have watched my senior nurses take care of people, take care of junior nurses, and make them what they are today. I'm a product of the effects of of my senior nurses. And saying that this position gives this opportunity, I would like to also pass my own quota to the next generation. I would also like to impact the next generation, teach. I already do this in my current role where I teach people in help student nurses as well. But I would like to do it in a much more senior role, because then I can be able to impact more people. And that's why I'm applying for this particular job role. This job role entails leadership. I've been a leader over time, okay? And I understand that being a leader as a band 5 is different from being a leader as a band 6, okay? As a band 6, you can be able to make decision and implement decision in the growth of an organization. And I've always been one that wants to help this organization to grow, help the NHS to grow. And so that is why I am applying for this role, because then I can be able to work in the leadership position and be able to help my quota when making solid decision in growing the NHS or in growing the organization. All right. Now you look for another, maybe the third one. This position also involves people that do auditing, and auditing or research is something that is needed for innovativeness and development in practice. And I love being I'm someone that loves research. I'm someone that loves always going to do things like knowing new findings. And this particular role offers such thing. And so I would like to work within this particular place where I can offer myself. And that is why I applied for this role. So you see that the way I went about that question is different from, why do you think you are the best person for this role? Why do you think we should employ you? Why do you think we should employ you? Because you're looking at, okay, let's say you're looking at qualities. You want this type of person. It's more person specification. Okay, why you think I should employ you? Why you think you are you are the person for this role is more of a person specification answer. It's talking about the individual. It's talking about the person. Okay, but then why did you apply for this role? It's talking about the job description. Do you understand?
Okay.
Now,
Yes.
do you understand?
Yes.
Okay, I don't know if you guys are understanding what I'm saying. Now I've spoken a lot, but why you think you are the best person for this position? Okay, why you think you are the best person for this position? Why you think we should employ you? Is more of a person specification answer. So you must know the person specification to give an answer to that question. You understand? But the next question, why did you apply for this role? It's more of a job description kind of one. You've looked at the job description. You understand the job description, what the job description can offer. You understand it. You understand yourself as a person. And that is why you are applying for this job description, because you know that you can do that job role. You are doing it somehow, but you want to come and offer it in a bigger way around the job description. Am I making sense?
Yes, ma'am.
I hope
Yes,
I've
ma'am.
not
You're making a
confused
whole lot of
anybody
sense.
anyway. I hope I've not confused anybody.
No.
Because
No.
it's a
I
different.
want to know if you can personalize it like this. Why are you applying for this role? Can someone start saying, maybe I had a family member that had a mental health condition, and like all those stories?
Which one, for which particular question now?
For
For
that one is for like
why you
personalizing it, like
apply for
for
this role? Actually, you can personalize both
Yes.
answer. Okay, you can
Okay.
personalize both answer.
Okay.
For example, you are applying for a position of even a general nurse. Why did you apply for this role? All right. Okay, I'm someone that has been in nurse
Okay.
for, or let's say you are even a new person. Say, why do you apply for the role of a nurse? I'm someone that has always been involved in care for a very long time. I've had a family member, or let's say dementia. Let's look for dementia, because you cannot say no, you're already a nurse. Why are you interested in the
Yeah.
role of a dementia? Why did you apply for a dementia role as a nurse? Okay, why did you apply for the role? I'm someone that has been involved in care for quite a long time, okay? And in my years of practice, I've worked with people of different age, both young and old. And I've realized that I have this love for caring for the elderly. This love actually started from a time whereby I cared for my grandfather who was dementia. It made me understand the uniqueness of people who are dementia, how I can go on and beyond. Before, I didn't really have this full understanding of it. And me seeing that this seeing how I offered care and also watch the nurses that offer care made me have a key and strong interest in wanting to apply for this particular job role. Okay, dementia will give me this dementia nurse role will give me an opportunity to care for people who were like my grandfather. It will make me offer care to people in a bigger situations. Okay, I can be able to improve my knowledge and help people both at home and both while they are in the hospital. I can be able to also educate their family members as well in caring for this particular situation, and that is why I applied for this job role. Can you see how you can personalize it?
Yes, ma. Yes. Thank
You
you.
see, that is even very sweet. Like, if there's a way you can even relate it to your personal self of a particular thing, you understand? It makes them see like, okay, so it's something that you already have. Now, for someone that the other question that I say, why you think you're the best person for this show, you can also go in another way. Okay, the role is the role of a dementia nurse. Okay, I've been a nurse for quite a long time, and I've cared for people in situation of people of different age as well. Recently I had my grandfather who had dementia, and I have seen the importance and the care that and their demands, the needs and the demands. So I was able to manage this situation. I was able to care for them. And this has improved my knowledge, okay? And because I've been able to manage and offer quality care to my grandfather or to my neighbor or to my patients in my particular in the hospital wherever I work, I believe that if put in this situation, I will be able to also offer same care because it's not going to be new to me anymore because I've managed dementia person. I know yes, each person is unique in their own symptoms in which they demonstrate. But for the fact that I have been able to have an understanding and experience with a dementia person, I believe I'll be able to manage a dementia role if I am given this opportunity. And that's why I believe I am best for this role because I have had this experience. I can be able to adapt to this role. Okay. Am I making sense?
Yes, ma. Yeah.
So
Please,
Thank you.
I know will soon finish. Oh,
yes,
I,
Miss
I have,
Oshun,
I have a very big concern. So actually, the interview invite I got was for a band six room for
I
a
noticed
deputy.
because there's someone that was I think you also I kind of smelled it was a band six, but go on anyway.
For deputy ward manager, and I'm very confused, honestly.
But
I'm
it's
very
possible. Some people get band six from Nigeria. It's weird, but it's possible. Okay. At the end of the day, it depends on how you are playing your card to them. Have you gotten your pin?
no, not
That's where those going for self-sponsorship actually have advantage over you. Okay, those that are going for self-sponsorship. Okay, if if they are if they have gotten the loan, that actually gives them upper hand as they just want to demonstrate that they are fit for this role. Okay, they need to show because really they want someone that is already a UK nurse to get this particular role. That's the truth. Okay. That's the only thing I think you have as a drawback to this particular role. But nevertheless, the rest of it is for you to play the game based on all we have said. Like I say, interview is all about you understanding what they want and giving an answer. Someone should mute their mic. Thank you for telling this person that we not hear
Fresh.
what they fresh. No, I have muted on myself.
Oh, okay.
Okay. So, like I was saying, right? Interview is all about you being able to understand what they want and using what they want to give an answer to what they want. A band 6 deputy manager, what they want is simple. They want you to be able to teach somebody. They want you to be able to manage a ward. They want you to be in charge of a ward. Okay. They want you to understand what it is when it comes to conflict management. You are not going to be talking or giving an answer now as a band 5. If they're asking you questions like, okay, can you tell me, a person comes to report to you that such a thing happened, conflict happened, or someone talk to them rudely, or they don't like the way something is, how will you manage it? What, as someone that is a manager or someone that is a senior person, how will you manage the situation? Okay, how will you handle it as a person? That's what they want to know. You're not just going to say you're talking like a band 5. All right, band 5 is the floor work. They don't do any managerial thing. You are like a senior person. At times, you might be the most senior on the board that day. How will you manage it? You make sure the environment is okay. You call them individually and speak to them and see if they would like to come together and have a time to speak to each other about it. You speak to them together once they have agreed and try to resolve the issue the best way that you can. If they need to be compromised, if they need to be come to an understanding, but make sure that it's resolved in a way that it does not hamper the care of the patients. Make sure you tell your ward manager, because at the end of the day, you are reporting to your ward manager, who is your senior, okay, about what has happened, okay? So you understanding how to manage conflicts is one of the roles of a band 6 and deputy. How do you manage someone that's how do you manage an incompetent nurse? Because as a band 6, you have nurses that are incompetent. They don't know, they are making mistakes. That's your role. How will you identify them and be able to train them? What will you do in such situation? Okay. So you knowing how to give such answer, because those are the type of questions they will be asking you. They'll not be asking you all these band 5 questions. They'll be asking you managerial questions. Okay. How you manage someone that's an incompetent nurse? First, you meet the person. I want to understand the person. Or first, you go through the person work of what the person has done before. Okay. Go through it and see where the person needs training in. Then you come to the person and have a chat with the person. Ask if the person is all right. Is there any personal issue? Is there anything that is affecting the person at home? Is there any support the person needs? Have a discussion on what you've noticed and how best you can support, how best the person would like to learn. So people learn by reading, so people learn by attending seminars and all of that, okay? You create a plan for the person, maybe a 3-month plan or a 6-month plan for the person, and follow judiciously on ensuring that the person follows those plans and support them as much as possible. You can put them with one of the competent nurse or band 5 nurse who is going to support them in their journey during this particular period. All right. After the review, you can have a chat with them to see what they've done. Also, monitor their progress. Have there been a change after it? If there is no change, do you need to put them again on another training? If after all the training, they still keep making such mistake, then you'll be discussing with your manager. If it's the case of taking it up to a senior place, maybe they want to review the person's skills and see what they can do. Maybe they might reduce the person to about 4 or something, but you don't need to go, or just say you speak with the manager if the person keeps not improving despite all the plans of having to coach them, the person keep repeating the same mistake, to see what they can do. You understand? Maybe it's the case of involving the HR in such situations, because at times people just don't want to learn, and that's the truth. So so it depends on how you manage such situations. There are so many examples online, all right, of how you can manage such situation. So as a band 6, you are managing people. Okay, so they'll ask you conflict management, they'll ask you management of people that make mistake, they'll ask you on a day-to-day, what's the role of a band 6 from start to the end? What does a band 6 do? But if you have experience in NHS, you already know the answer because you're in charge most of the day. You need to review the patient, everybody in the ward. But at times, you don't need to have experience in the NHS to know. If you're in charge of the ward in Nigeria, what will you do? When you start the work, don't you review all the patients in the ward? Because they are your patients. Everybody in the ward is your patients. You review all of them. You see, what does this one need? What does this one need? Who is due for discharge? Who are the most sick ones? Who are the ones that needs the most attention? Prioritize. You allocate staff, delegate responsibility, allocate staff based on their competence. You put the most competent or with the sickest patients. You put the ones that are not so strong with the ones that are with the level people that are still strong, patients that they can manage, you understand? But make sure you do a skill mix in a way that at the end of the day, you somehow train the ones that are not very strong to gradually become the ones that are strong. You gradually train them. Okay. You can add nurses, student nurses to the competent nurses. You understand? If they are healthcare assistants, which we don't really have in Nigeria, but you allocate them to those that need support in repositioning and all of that. Okay, you plan the breaks because there needs to be a break. You plan the breaks. You look for those that need discharge, those that need referral. You look at the ward as a whole. What supplies are needed in the ward? What do we not have? Order them. Make sure the ward is organized. Okay, you follow up on your staff to know if they are okay. Is there any way that they need support? You know, these are ways you manage the ward on a daily basis. Okay, so you can just be related to your. So it's more. They will not ask you like, can you tell me a time when you make a medication error and this thing? No, they will not ask you. Can you tell me a time when you made a mistake? They will not ask you all those questions. They will not ask you all those questions. So the questions they will ask you are the questions I'm telling you. That's the questions they'll be asking. It's a total different questions entirely. So you need to go and browse Francis questions, see how it's been answered, and prepare yourself. I try to relate it, don't because you are in Nigeria, so try to relate it to Nigerian situations to save yourself some stress. Okay? That makes it easy for you to give an answer. But just know that it's managerial questions they'll be asking you. All right. Now, we're coming to the end of this section. I want to talk about OSCE. Okay, you guys should for those that, I don't know if Mr. Ace, are you here? You wanted to speak on it.
Yeah. I'm here actually. I'll be following all the background all the while. I want to sincerely appreciate you for the interview session. I was supposed to be a part of this session today, but I got tired. It's not easy. I'll be very, very busy operating. So please, warm apology. That being said, in addition to many of the things you have received today, by the way, my name is Otaigbe His. If you are seeing my face for the first time, happy to meet you. If you are used to my face, glad to see you as well. We'll be having a little bit of a gist about interview. I was a little bit disappointed that some persons have decided to be here and they were muted all through. That's not really good for you because on your interview day, you are going to be displaying. So we actually open this forum for you to come make all the mistake you can make in the world. So that on your interview day, you can actually go ahead and shine. So if you haven't spoken today, the session is recorded for you. We'll also try as much as possible to send it on the group, and please do your best to be able to replay everything that was done today. And now, there are some things that were said here that we had repeated in our previous video. There are some that were not said here, but were actually spoken about in our previous video. So please, if you can, try your best to watch the previous video. It will also help in guiding you ahead of your interview. Now, I can see many of you are having your names on your Zoom link. Some are having their first name, some are having their son name, some are having their both name, some are having Zoom user, some are having iPhone, some are having, and so on and so forth. So I appeal to you, go and change your name. You may not be using Zoom on that day. You may be using Microsoft Teams. You may be using any other app. So any app that is given to you, make sure you change your name to suit that app. So let your name be your full name. Because when an interview is granting, an interviewer is assessing you, sometimes they are going to bring people from the world. So they could be your deputy manager that are there to support or to take note of who is best suited for the role. So you don't want somebody to be seeing you and he's seeing Zoom user, or he's seeing iPhone, or he's seeing Sexy Jane, or he's seeing Kevin Mama. You understand? So as I always say, people have different culture. What if an Indian lady is your deputy war manager and is there and is seeing Sexy Jane? So it's already giving you a red flag. So you get that point. It's already giving you a red flag. So please, before people judge you, they don't judge a book by the cover, but you know, first impression matters most. So if the first impression they are getting of you is Sexy Jane, it could also be an indication that, okay, this person may not necessarily be the type of person they want to bring into our organization. Again, as she said, and I want to emphasize it on it again, interview is telling the examiner what they want to hear, telling the interviewer what they want to hear. If you can successfully convince the interviewer what they want to hear, you are going to succeed. Now, this is not a case whereby you are applying for an IT role when you are not an IT guru. This is not the case. You are a nurse. You are applying for a nursing role. Now, for you to be able to tell the interviewer what they want to hear, you will have done your due diligence. And what is your due diligence? Your personal specification and your what? Your job description. So UK job interview, about a job interview, any job interview, any international job interview you can think of, they are all cheats. They are all cheats. You can cheat. And the cheat is what? Study the job description, study the personal specification. It's like they've already given you an open book. Read about this. Tell us about yourself. In everything, have a strategy. If you have a husband, you have a wife, you have a boyfriend, you have a girlfriend, at this time, practice with him or her. The more you practice, the better you become. The person can sit down with you and say, okay, these are potential questions that can come. We have a Telegram group that have a compilation of questions. So you don't really have excuse. If you can attempt all those questions, there should be over 500 or 300 or 200 group questions now right on that Telegram group. And they were shared by people like you going for interview. They are not just manufactured questions. It's not that type we started using how to type it. No. They have gone for their interview. In order to help those that are coming, they now say, okay, let's put this together to help these people. That's why it is there on that Telegram. And many of you have come here as a result of being on that group. So this is also an appeal to you. You've already written on the group that you are going to have interview by so and so date. When that date now comes, you didn't share your interview experience, you are not really doing justice to what we are actually aiming to build. Because think about it. If while you are going for this interview, the question that is about to come out, you have already gained access to it, what will happen to your process? Speed. So interview, past questions sharpens your cutlass as far as interview is concerned. So please, after your interview session, try and write down those questions that comes out and also share on the group. Then we'll modify it and share on the Telegram group. This is important to us. We are sacrificing our time here now. Stella is UK based. I am UK based. So even if you want to, we are charging you for this interview session. Maybe we'll say pay 5,000, pay 10,000, which we are not even asking for. It's free. So you are not paying me anything. You are not paying her anything. Any of our team members that have ever heard this session, you are not paying them anything. And we've been here now since, let's say, 7:30. I may not have been speaking, but I was on the background following from start to the finish, like a student. You understand? I have a boxing match to watch. Ginseng King is about to fight, but I have decided to sacrifice the time to be following this session. So you too have a role to play to help your future colleagues. It's not a thing of, oh, I did my interview, I wasn't successful. Because I wasn't successful, I am done, so I'm not going to share anything to anybody. No, you are not really doing me. You are doing the future generation that will come tomorrow. Now, mind you, many years ago, all these trends we are seeing now, they weren't like this. It's not like as if it has always been like this. No, it hasn't been like this. So every road that opens, there is time for it to close. It's not only Africans that are going to UK. There are Indians, there are Philippines, there are so many. So we are trying to create that advantage to our fellow Africans so that tomorrow, when you travel abroad, you will have your brother, your neighbor nearby to you. Even if you are so busy, somebody can take care of your children. And what can you do to support them? By simply sharing your experience. Because tomorrow you may have a trust with trust A, and you now get an interview with trust B, and you eventually move with trust B, and your colleagues are coming, your junior colleague. Now that you see now, they always say the uncle you call uncle yesterday, you are not an uncle now. Sooner, you will soon be a senior colleague to junior colleague that are coming. The legacy you play for them today will go a long way. So that's why we're advocating for those past questions, so that your colleagues that are coming tomorrow that will see that same question, they will be able to prepare better, prepare well ahead of their interview. Because trust me, most of these interviews, they are repeated. They will repeat everything. They don't have time to be drafting new set of interviews. Even if they want to modify, it will still be similar pattern. So please, we appeal to you. When you finish your interview, try and write everything down. Name of the trust, date you had the interview, number of interviewers that came, and then the question you can remember. Even if it's 5, you can remember. Even if it's 10, even if it's 2, post it on the group. One question that an individual know can be the thing that changed the goal for another person. People have gone for the interview. If you go to the group, go and make comparison, you see that if a particular trust has done interview before, another person went for that same trust, the past question they are going to send is the same. They may scatter it, one will come up, the other will come down, but it's the same. So that's why that group is invaluable. So if you also have your colleague you want to add to the group, feel free to add them up. It will really go a long way to help them. Now, stretching back to interview again. Interview is what? Telling the examiner or the interviewer what they want to hear. And what they want to hear is already written on your job description and personal specification. So work with your family member, work with your brother and sister, work with your boyfriend, your girlfriend. Sit down, let them ask you the question, and then you provide the reply. The more you do it, the better you become. If you have an issue with your first interview, don't worry. Second interview, don't worry. Note that it is one thing to have issues, another thing to ask yourself, where have I done wrong, so that you can improve upon it. So don't always go for trial and error, but if it happens, ask questions. Email the interviewers and ask them, okay, after this session, I know that I wasn't successful. Please, what could I have done better? What do you think I have not done right? And another thing you should also do is, if you have not successful in an interview and you felt you did very well, you should also email the recruiter and let them know that, yes, I know that the competition may have been great, and I was really keen on getting this interview. Unfortunately, it was not the case. But I want to appeal, if there is any case of a student, a candidate withdrawing from the trust, I will be really happy if I am contacted, as the trust value of this trust really matches with my personal value, and I'm keen on giving my quota to this trust. By doing something like that, there are many trusts that they will recruit people. Some persons will get 3 interviews. They will become successful in 3 different jobs. They can only pick one, so they will withdraw from 2 or withdraw for 3. So all these people, sometimes they scan again and say, okay, which people were best that really wanted this role? And you will see that a job that once told you that you were unsuccessful can still call on you again to what? To come and pick your offer letter. So everything is what? Wisdom. And this thing, you don't get it anywhere. So please take advantage of all these things. When you have an interview session, don't just let it go there. So do a follow-up. It matters a lot. It matters a lot. Now, there are a whole lot of things now regarding NSC UK is under suspension for those who are in Nigeria, a red list affecting some African countries and so on and so forth. Remain consistent. Remain consistent and remain consistent. If you are not able to get your letter of good standing, as they always say, oh, letter of good standing, letter of good. Trust me, if you have gotten an offer with any UK trust, they will give you the letter of good standing. So that shouldn't be a problem for you. And as we are speaking now, there's ongoing meeting regarding reinstating verification. So you shouldn't be too bothered about that. What I always advise is work your way towards opportunity so that when opportunity comes presenting, you will be ready for it. If opportunity comes knocking and you are not ready, it will be a problem. So be ready for opportunity. And that being said, God helping us, we currently have been offering training for those who are actually working their way for the self-sponsorship journey. Now, God has been so faithful to you, you got the job. Now, you got the job, good and fine. So run with it. Give this interview your best shot. Now, even when you are successful in your interview, you are not successful in your interview, we want you to be successful in your interview. Even when you are successful in your interview and you have gotten your offer, and the trust promises to sponsor you, if you know that you are going to UK tomorrow, we still have a package for you in our OSCE team. So that even before you go ahead to say, oh, I have relocated to the UK, you already know what the OSCE is all about. Because what some trusts are doing now is they will do a crash course for you. They will just say 2 weeks. 2 weeks, you must learn everything about OSCE. You will not be under pressure. Some will say 3 weeks, some say 2 weeks. And some will go and merge you with another trust where you will be getting the training. So you will not be under pressure. So what now happens to you if you have already learned everything at your comfort zone while you were in your own home? You've already learned everything step by step, broken down into smaller pieces in your own home. So you see that sort of advantage is something you don't want to let go of. So if that is your case, you can actually key into our classic OSCE program, which we have heavily subsidized because we are keen on helping as many Africans as possible. It's our dream that every family deserves a representative abroad. Every family deserves a representative abroad. You don't travel abroad because of the money alone. You travel abroad because of exposure. You travel abroad because of personal growth and development, and so on and so forth. For those of you who are on the journey for the ABATA service, we have the NCREST program that is solely for you. NCREST program solely for you. With going for Australia, moving from UK to Canada, moving to US, wherever you are going, as long as you need NCREST. Our classes so far has been classic. It has been outstanding. It has been anything you can qualify it with.
Now, free class tomorrow.
Yeah, okay. So there's a free class tomorrow. It's still part of our giving back to the society. And then, one thing I want to reassure you is, you don't want to get to ABATA. You don't want to get to Canada before you start rushing. You start your preparation now so that by the time you get to Canada, you don't be under pressure. You get to Canada, you know that, okay, I am smashing my anklets because Abata is really doing a wonderful, wonderful job. The only problem now is many people don't key into opportunity. Groups that will help them, they will want to exit and before me, I don't like joining too many groups. I don't like joining too many groups when they have not achieved their aim. So please, you need to be versatile. You need to be versatile on this journey. You need to be versatile. You are on this road not because of yourself. Don't be selfish, as I always say. You are making this bold step you are taking today because of your children, because of people coming, because of people that are dependent on you. Because one tremendous change that happens to your life can change the entire generation. It changes the whole narratives. So don't allow that opportunity to slide because of personal greed, and you say, I'm okay, I'm satisfied where I am now, so I don't really need. So that is basically it on that. NCLEX program is ongoing, CBT program is ongoing, OSCE program is ongoing. Any program at all, you already know that we have a track record in IELTS. If you think it's not possible, that means you are our target. If you think it's not possible, you are our target. So we are here to solve it and make it look like baby for you. So God helping us, hopefully will also be a part of your success story. And please, after your interview, don't hesitate. Don't allow us to come and be coming to your DM again and be saying, you had the interview today. Can you share the past question? After all this sacrifice, so please, me, I don't need the past question. You know, I'm not asking to change the job. You understand? I'm an examiner here, so it doesn't concern me. I have a brand. So that one is not, if you and the people call me, people will come tomorrow and be saying, there are some people that did some trust. There was a particular trust recently. They did interview for some persons and they took a lot of persons. And then they said they opened another badge again. Then somebody was complaining on the group. He said, this same trust did interview the other day and people were part of the interview session. We were asking them to share past questions. They didn't share it. They all keep mute. And now the same trust is recruiting again. How do we now know what they are asking for? Now we reach out to some of them that did the interview. We now ask them how the interview did. How was it? He said yes, it was really good. It was fine. I was successful. And that's okay, good. Can you share the past question that came out? Say, oh, I forgot to share it the other day. Let me try and see if I can still remember. If I can still remember, only three. Three questions the person can still remember. But meanwhile, if it was on the eve of when it happened and he shared those questions, he will have been solving more problems and liberating more persons. Imagine when you are going for a journey, you already know that this is what to expect. The journey becomes clear and fine and easy. So that's basically it on that. So we appeal to you, help your colleagues, and hopefully the Telegram group will continue to serve more nurses, more professionals as far as a relocation is concerned. Thank you so much for taking our time to be a part of this session. I sincerely appreciate everyone that spoke today. If you know that your Zoom name is still bearing a first name or surname or bearing a strange name, please try and make the appropriate adjustments. And don't just leave this video. Try your best to watch it over again because there are remarks that you may not have captured. Maybe as a result of network glitches, as a result of challenges whatsoever, or anything that may have altered your sense of following, so that you'll be able to have a full grasp of everything that was done in this session. Again, there are previous videos that have been done. If you can put everything together, you see that success will be chasing you. I wish you all the best. Success to you all. My name is Otaigwe Ehis once again, and Mrs. Stella was your anchor interviewer for this session. I believe that she did a great job. Maybe we'll hear one or two comments and then we'll call it a day. Thank you so much, everyone. Thank you.
All right. Thank you very much. We appreciate your efforts.
Thank you.
All right, thank you very much, everybody. Thank you so much. Don't forget to review other videos, because then we went, there's some things we explained, like sections of questions that they asked, like pressure ulcers, how to conflict management, medication management, and so many of them, falls, risk assessments. So we broke them down into different categories, like of
Please, how
questions
do
you
we
should
access
expect.
this video?
We'll send it to the group. So, because we talked about different categories of
What about the
questions you
previous one?
expect. So we broke them to different categories of questions you should expect. And we went like we explained those. So time will not permit us to start doing all of that now, but it's also good for you to watch all of them.
Sorry, please, how can we access the previous one?
It's on the YouTube channel, but we'll share it. We'll share some of the links down so that you can look at them as well too. So on our YouTube channel.
Thank you.
Also, someone asked when is our free English class? It's tomorrow at 7:30 in the evening. It's on Telegram, so we host our free English class there. So please try and join that group. It's very important, especially for those that want to go to Canada and USA and Australia. You need to write English, and it's going to help you. Imagine these tutors are someone that passed these exams, and they've helped people not just in Nigeria but people in USA. They've helped them pass their English, so they are so good. And they are so amazing, to be fair. So you join the free class and get their knowledge free of charge. Who teaches English for free? Not very much people. All right, thank you again, and see you guys next time. Bye bye.